If you have high blood pressure, there is a natural herb that can quietly raise your numbers, override your medication, drain your potassium, and in some cases, send people to the emergency room with heart rhythm disturbances. And most of them had no idea it was the cause. It's licorice root, not the candy. I'm talking about the herbal extract hiding in teas, traditional remedies, adrenal support formulas, and stress relief supplements. It's marketed as gentle, healing, safe. But inside your body, it behaves nothing like a harmless herb. I've seen patients doing everything right, cutting salt, exercising, taking their prescriptions faithfully, yet their blood pressure stayed stubbornly high. The missing piece wasn't more medication. It was a daily cup of licorice tea. Here's what almost nobody tells you. Licorice can hijack your hormone system. It makes your body retain sodium, lose potassium, and increase fluid volume. The perfect storm for hypertension, swelling, and dangerous arrhythmias. And the worst part? You may feel completely fine until your blood pressure spikes or your heart skips a beat. In this video, I'll show you exactly how this happens and how to protect yourself. Here's where most people, and even many healthcare conversations, get it wrong. When your blood pressure goes up, the immediate reaction is to blame salt, stress, genetics, or aging. And yes, those factors matter. But what often gets overlooked is why your body is retaining more fluid or tightening your blood vessels in the first place. Medicine frequently focuses on suppressing the numbers. You're prescribed a diuretic to push fluid out, maybe an ACE inhibitor to relax blood vessels, maybe a beta blocker to slow the heart. These medications can be life-saving. I'm not dismissing them. But they mainly control the effect. They don't always identify the hidden trigger. Licorice root is one of those triggers that flies completely under the radar because it's an herb, because it's traditional, because it's sold over the counter, and because no one thinks to mention their herbal tea when reviewing medications. Here's the dangerous misconception. People believe licorice affects blood pressure the way salt does, mildly, temporarily, and only if you consume a lot. That's not how it works. Licorice doesn't just add sodium to your diet. It alters how your body handles sodium at a hormonal level. It interferes with a key enzyme system that normally keeps your stress hormone, cortisol, under tight control. When that regulation is disrupted, your body behaves as if it's being flooded with a powerful hormone that tells your kidneys, hold on to salt, dump potassium, retain water. That's not a minor dietary issue. That's endocrine manipulation. And here's what makes it worse. This effect can happen even in people who don't consume massive amounts. Regular daily exposure, a few cups of licorice tea, a supplement containing licorice extract, or certain traditional remedies can be enough over time. The result? Elevated blood pressure that doesn't respond as expected. Low potassium levels, muscle weakness or cramping, swelling, headaches, and in severe cases, abnormal heart rhythms. What's especially concerning is that this pattern can mimic a condition called hyperaldosteronism, a hormonal disorder, even though the adrenal glands themselves are not the problem. The herb creates a functional hormonal imbalance. So instead of asking, why isn't my medication strong enough? The better question might be, is something I'm consuming overriding my body's normal regulatory system? This is the root issue. Licorice doesn't just worsen hypertension. It changes the hormonal environment that controls fluid balance, electrolyte stability, and vascular tension. If you don't remove the trigger, you're fighting uphill, adjusting medications while the underlying driver is still active. And that's why understanding the mechanism matters. Now let me show you what's actually happening inside your body, and I'll keep this simple. Your body carefully regulates blood pressure using a balance between hormones, kidneys, electrolytes, and blood vessel tone. Think of it like a highly coordinated plumbing system. The kidneys are the control valves. Hormones are the instructions. Sodium and potassium are the electrical signals that keep everything stable. One of the most important hormones in this system is aldosterone. Aldosterone tells your kidneys to retain sodium and excrete potassium. When sodium is retained, water follows. More water in the bloodstream means more volume. More volume means higher pressure inside your arteries. Now here's where it gets interesting. You also have another hormone called cortisol, commonly known as the stress hormone. Cortisol can actually activate the same receptors as aldosterone, but under normal circumstances, your body prevents that from happening. How? There's a protective enzyme in your kidneys called 11-beta-hydroxysteroid dehydrogenase type 2. Don't worry about memorizing that. Just think of it as a security guard. Its job is to convert cortisol into an inactive form before it can bind to aldosterone receptors. In other words, it prevents cortisol from accidentally raising your blood pressure. Licorice root contains a compound called glycyrrhizin, and glycyrrhizin blocks that protective enzyme. When that enzyme is blocked, cortisol is no longer neutralized. It starts activating aldosterone receptors as if it were aldosterone itself. But cortisol levels in your body are much higher than aldosterone levels. So now you have an exaggerated signal telling your kidneys, hold sodium, dump potassium, retain water. This creates what we call a state of apparent mineralocorticoid excess. Your adrenal glands are not overproducing aldosterone, but your body behaves as if they are. Let's break down the consequences step by step. First, sodium retention increases fluid volume in your bloodstream. Imagine adding more water to a closed hose. Pressure rises. Second, potassium levels drop. Potassium is essential for electrical stability in muscle and heart cells. When potassium becomes low, a condition called hypokalemia, heart rhythm becomes unstable. Muscles may feel weak. You may experience fatigue or cramps. Third, increased fluid volume forces your heart to work harder. Over time, this adds strain to the cardiovascular system. And here's the subtle danger. This process doesn't always cause immediate dramatic symptoms. Blood pressure may slowly creep up. You might feel a little off, but not alarmed. Meanwhile, potassium levels may quietly fall. Because cortisol is involved, this mechanism also connects to stress physiology. If you're already under chronic stress, your cortisol levels are higher. Add licorice to the mix, and you amplify the effect. So this isn't about candy. It isn't about flavoring. It's about a biochemical interaction that overrides one of your body's key safety systems. When you understand this, the pattern suddenly makes sense. Unexplained hypertension, low potassium, swelling, arrhythmias. Not random, not mysterious, mechanistic. And once you see the mechanism, the solution becomes much clearer. Now let's talk about what you can actually do, starting today. Because once you remove the trigger, your body often corrects itself remarkably well. Number 1, eliminate regular licorice intake immediately if you have hypertension. If you have high blood pressure, borderline readings, unexplained low potassium, or heart rhythm issues, stop consuming products that contain real licorice root extract. Check labels carefully. Look for words like licorice root, Glycyrrhiza glabra, glycyrrhizin, licorice extract, herbal teas, digestive blends, adrenal support supplements, and some traditional remedies commonly include it. Don't assume herbal means safe. Number 2, understand the difference between licorice and DGL. There is a form called DGL, deglycyrrhizinated licorice. In this version, glycyrrhizin, the compound that blocks the protective enzyme, has been removed. DGL is often used for digestive support and does not have the same blood pressure raising effect. If you need licorice for gastrointestinal reasons, make sure it specifically says DGL. Number 3, monitor your blood pressure after discontinuation. If licorice has been contributing to your elevated readings, you may notice improvement within days to weeks after stopping it. Track your blood pressure consistently. If you are on medication, do not stop your prescriptions on your own, but share the information with your healthcare provider. Adjustments may be needed once the trigger is removed. Number 4, check your potassium levels if symptoms are present. If you've experienced muscle weakness, cramps, fatigue, swelling, or irregular heartbeat, especially while consuming licorice, ask your doctor to check your potassium level. Correcting low potassium is critical for heart stability. Number 5, be cautious with adrenal support products. Ironically, licorice is often marketed for stress and adrenal fatigue. But if you already have high cortisol levels due to chronic stress, licorice can amplify the mineralocorticoid effect even further. If stress is your concern, focus instead on sleep optimization, light exposure regulation, resistance training, breathing practices, blood sugar stability. These address cortisol rhythm without disrupting electrolyte balance. Number 6, remember that dose and duration matter. Occasional small amounts may not cause harm in healthy individuals. The risk increases with daily intake and prolonged use. If you have hypertension, heart disease, kidney issues, or are on diuretics, your tolerance threshold is much lower. This is not about fear, it's about awareness. When you remove hidden drivers, your cardiovascular system often becomes much easier to manage. Here's the bigger picture. Licorice is just one example of how hidden hormonal triggers can silently worsen high blood pressure. If you truly want to control hypertension, you have to understand the deeper systems: stress hormones, insulin resistance, sodium sensitivity, and vascular inflammation. And if you haven't watched my video on how chronic stress and high cortisol levels silently drive hypertension, I've placed that video right here. Go check it out. It will connect everything you learned today to the bigger cardiovascular puzzle.